Hi, this is Ask Dr. Anna. You're worth it. Don't give up. This whole idea of making sure that you remain patient with yourself throughout the cycle of recovery. Ask Dr. Anna is always about your questions, your comments, and things that are important to you to talk about after trauma. Remember, we always protect the background and the history of the individuals that are sending us letters. And so today we're going to read from Gina. I've been seeing a therapist for going on 2 years now, and I've tried hypnotherapy, NET, and DMDR. I've tried educating myself the best I can about PTSD, medications, different types of therapy that might help. So far, not getting much relief from anything. Everyone keeps saying it takes time. How much time? I used to be a patient person, but I feel as though I'm losing my mind, and it's not getting any easier to cope with it. It's actually getting harder. Any tips? And by the way, how does one go about finding a trauma therapist? What a frustrating time I'm having. The waiting lists are either very long or you end up paying $200 an hour, and I'm going into debt trying to find help. Thank you so much, Gina, for sending us that email. And I really, really do understand how tough it can be while you're in that cycle and you're just processing through and really trying to dedicate yourself to your recovery. So congratulations for working hard. And one, I want to really start by encouraging you to recognize that you're actually worth it. Keep working at it and recognize that that is actually part of the cycle, that you actually do need to keep working. I've worked with many people, and there's this kind of tipping point where they start to notice that they've worked through enough of these stories, that they've experienced things, that they actually see them in a different light now. So I want you to know that this can happen for you as well. Now, the other thing that you said, it's hard for you to find therapists locally and deal with the cost of it. So, I do want you to start looking at some of your local hospitals and community centers. There are a lot of resources that are local, and there are also likely to be organizations that train therapists, and you may want to contact them and see if you can go and see a student practitioner, because, and this goes right into my next point, which is, I want you to recognize that there may be the need for fresh eyes. Sometimes we actually have to step back. I know you're telling me that you have PTSD, but there may be other things that are making your recovery difficult. So I want you to actually step back from the whole idea of trauma and ask yourself, what else is contributing to this? Or are there very specific symptoms that are most difficult for you to deal with? And I want you to see if you can focus more precisely on those symptoms and see if you can help somebody work very precisely with that. Or if there are themes, I want you to see if you can actually work with the themes. So, for example, if one of your themes is, I'm a terrible person, or nobody loves me, I'm not lovable, I want you to work with somebody who understands how to deal really precisely with the themes that are bothering you the most. And there's a new approach called thematic map that's very, very good at getting at those types of thoughts. And then finally, do not give up. Look, you need to be your own champion. That is absolutely essential. Nobody's going to take over that job for you, so I want you to continue to work hard. I want you to also recognize that if, for example, you've experienced trauma many years ago, all of the things that have contributed to the struggles you're having today have taken years to form, and now they will likely take time to unform. So it's almost like you're recreating yourself, and you need to give yourself the time to do that. I want you to spend time every day picturing who you actually want to be and start to take the steps towards that person. So instead of focusing only on the trauma and the things that have been a struggle for you, I want you to actually envision who you want to be and where you want to be in life. Finally, let's recap. First, you're worth it. Keep working. Second, use local resources. 3, look at the problem with fresh eyes. 4, be your own champion. And 5, picture who you really want to be today. This is Dr. Anna Baranowski wishing you a gentle day.